Well, hello, this is Mike Fraser. I'm CEO of the Association of Maternal and Child Health Programs, and it's an opportunity to speak with our past president and our president and our Go Beyond Reality Works MCH Scholarship winner, Libby Brockman. We have a few questions about leadership and where the field of MCH is going, and I'd like to start by asking our guests this afternoon to share a little bit about where they see the challenges of MCH leadership and give advice to our emerging MCH leader about potential for developing new opportunities and bringing her experience to the MCH programs of the future. So let's start. I'll ask Stephanie Birch, our AMCHP past president, what are some of the challenges you're facing in Alaska in terms of workforce and leadership, and what advice would you have for our emerging MCH leaders?
Well, thanks, Mike. I think the leaders of today need to learn how to be resilient and flexible and really think out of the box and find other partners to work with. And those are really the values and traits that I think have served me well over time. And so in doing that, I challenged during my presidency to think of leadership much more broadly in our organization. And one of the primary areas that I was really hoping to bridge some of these leadership competencies was over to our new and emerging MPH students. And so we went from, I think the very first year that I was president, I think we had a handful of students who attended, and the last year we were up to around 20 to 30, and I think this year I heard we're around 40 to 45 students. And Libby, who's going to talk a little bit about some of the work that she's been doing, is an example of an emerging leader. I'm pleased to say she's going to school at the University of Washington in our region. And I was teasing her, I was hoping she'd come up and do an internship or something with us in Alaska. But Libby exemplifies, I think, some of the energy and enthusiasm and creativity around taking what her past education has been and figuring out how to really apply that to maternal child health and the public health arena. So I'm going to let Libby talk a little bit about the kind of work that she's doing, what prompted her to even apply for the scholarship, and what she hopes to do over this next year.
Thank you very much, Stephanie. I'm Libby, and I am from Seattle, Washington. I'm a current student at the University of Washington, and I'll be done with my MPH in June. So currently I'm looking for opportunities to put my classroom learning to use. My background is in substance use and social media use amongst adolescents, particularly how adolescents use social media to engage in health promotion and how they use the internet to look for health information. I think that I would really like to include that social media component in my future work. I think social media is a really great tool for public health. It really allows us to reach populations, large populations at one time, for disseminating information as well as for collecting information. I think that is a tool set that I really want to take on from here. Additionally, I've had some really great opportunities here at the AMCHP conference in 2013 to network with individuals, and I think I'll take some of those lessons back to my graduate program and facilitate some networking events, as well as introducing some of the emerging MCH topics that I've learned here to a journal club I have back at the University of Washington.
Great ideas, yeah, that's fabulous. Yeah.
So let's ask Millie, who's with us. Millie's our AMCHP president from the great state of Wisconsin. What are some of the workforce challenges you all face in Wisconsin, and what advice would you have for emerging MCH leaders?
I think Stephanie hit upon some of the challenges that we have in Wisconsin, much like Alaska, but this transitioning that I think so many of us at the States are experiencing, where we've had very seasoned employees who have reached that point in their life where they're transitioning out of their current career into other career choices, or in many cases retirement, that's leaving a void for us at the state level. And so the challenge is to find the bright students like Libby and hopefully have a relationship and connect with them early on in their career, that they they then become part of the pool of candidates that we can recruit at the state level, and that they come into the state with a working knowledge of MCH, or at least a frame of reference. I loved Libby's ideas about social media, because it really is the emerging communication style for our nation. And if personally, for myself, if I have a prayer of a chance of connecting that social media, I'm going to need it with the partnership of some of our young people who simply have social media as their frame of reference. I mean, that's what they know, that's who they are. And so to have staff come in with that capacity will just be an absolute plus. So I too will outreach to Libby and think of ways that we perhaps can get her to Wisconsin. So she I think represents just an absolute ideal candidate and model of the kind of student who is in fact tooling herself to come into the workforce.
Fantastic. Are there things that your health departments are doing, Millie or Stephanie, to build the leadership competency or recruit your emerging leaders that might be good practices for other states to think about? That's my first question. And for Libby, I was going to ask, what are you looking for in a workplace, and do you think the state health department is a place you might want to bring your expertise?
Well, we've done several things. I've asked my staff to always have a running list of projects that potentially MPH candidates might be interested in doing from a variety of programs. We have a number of folks who do online programs, and so a full heavy master's thesis isn't required, but they need a capstone project, all the way to a research-based applied thesis. So we've got kind of a cataloging of ideas constantly going. I've heavily submitted abstracts for the GSIP, the MCHB intern, and I know MCHB oftentimes will call me and say, okay, you put in for 4, we have to back it off to 2, but we always have a wealth of candidates who are really interested. I also avail ourselves, our state, of always putting out applications for the public health prevention specialist, as well as the EPI folks, EPI trainees, and make sure that we are always submitting applications for that. Now, that said, it's important to make sure the workforce also is accommodating and attractive to folks of Libby's age group. And I'm fortunate to have 2 adult children, so they hit me over the head on a regular basis because they see me work too hard and not have good work-life balance. So I've tried to encourage my younger staff to help us do this better. So at our state, we have a fun and fitness committee. Of course, people know I love to have fun, so it's enforced. But it's really pretty much led by a number of our staff. We have flexible hours. We haven't quite merged into telecommuting, but we're sort of moving into that area. And they've been leaders in a number of fun activities and really social connectivity within the community, because Libby's generation, as is my children's generation, they're much more of the quiet little Peace Corps minded kinds of young people. More so than some of my age group of employees that are in their 40s or 50s. So, but I really, no idea goes unnoticed, and I encourage them to sort of think broadly about how we can make sure within a workplace, sometimes that is constrained by union rules, to make it as flexible as possible and as fun as possible. So those are the kinds of activities we've done in Alaska.
What do you think about Wisconsin? How are you approaching emerging leadership?
We've actually formed some stronger relationships with our schools of public health within our state. So we've really taken an internal focus and tried to offer some learning opportunities for the students in the School of Public Health during their training and educational period, to actually spend time in either an internship or fellowship role within our Department of Health or at some of our local community level agencies. And that's really offered an opportunity for students during this formative time to come into the workplace and both increase their knowledge, but also have an opportunity to build relationships and perhaps see themselves as part of our future workforce. So I would say one of the strongest things has been to work with some of our in-state resources like our public health schools and try to use that as a feeder.
Great, fantastic. So what are you looking for in a workplace? What do you think about state health departments in your future?
Well, truthfully, I never really thought that I could work in the Department of Health for the state. I have been so lucky to have attended the AMCHP conference this year and been able to network with a lot of people at the state level. So I have Reality Works and Go Beyond and everyone at AMCHP to thank for that. I would love to work at the state level. I think that community is a really it's really high on my priority list. I grew up in a very tight community, felt supported by my parents and the larger community around me in Seattle. And so I think I would really enjoy working at a state department so that I can stay connected with the community.
That'd be great. Well, there's tons of opportunities in maternal and child health, and part of what we're doing at AMCHP is trying to build our capacity to recruit the best of the best to come work in our state MCH programs, our territorial MCH programs. So with the support of partners like Go Beyond and Reality Works, we've had the chance to meet one emerging leader, and we're looking forward to seeing her blossom in the years to come and continue our scholarship program well into the future.